My name is Lauren Peters, and my intended field of study is nursing, and I intend to become a nurse practitioner. The minimum requirement to become a nurse practitioner is a Master's of Science degree in nursing. Of course, to do this first, you have to get a license as a registered nurse as well as an advanced registered nurse practitioner. There also might be individual licensure requirements in each state. I plan to study neonatal nursing and get a specialty in that, and after being in the industry for several years, I would like to go into nursing administration. My personality assessment revealed I have an ENJF personality type, which stands for extroversion, intuition, feeling, and judging. ENJF types are helpers, learners, and are very responsible, which is helpful because in the nursing field, you'll have to make many decisions. You're always learning, and you have to be responsible for several things all at once. My career coach test revealed that my strong matches are in health science, education, and engineering, and my weak matches are art, marketing, and finance, which is something I definitely agree with. According to my career coach test, a nurse practitioner would be a strong match for me. And my first step to doing this is at CF, obtaining my associate degree of sciences in nursing and my RN. Nurse practitioners can do many things. They provide primary and specialty care and can work in doctor's offices, hospitals, specialty offices. What they do is they apply principles they've learned in nursing to these medical fields. That's what makes them different from doctors. They apply the nursing principles of healing through the body, mind, and spirit. They examine, diagnose, and treat patients by creating personal treatment plans. They work with the patient and especially the patient's family to make sure that the patient gets the best care. NPs can prescribe medication in all 50 states. Some NPs can even own their own practices depending on where they live. And you can also work in other countries. The typical job duties for a nurse practitioner are writing prescriptions, diagnosing and treating infections, injuries, and illnesses. They can conduct and order diagnostic testing, examine medical histories to provide the best care. They talk to patients about effectively managing their health and creating the best treatment plans, and they provide care when it comes to taking medication, and they also really work with the families of the patients when it comes to doing this as well. The necessary skills to be a nurse practitioner include a strong academic background in healthcare and to be able to use this knowledge every day in the field. You also must have effective communication skills, compassion, be a good listener, be very patient, and have a high physical and mental endurance because some NPs will work 12-hour shifts, they'll work double shifts. It just depends on where they're working. There are many career advantages and disadvantages. Some of the advantages are the satisfaction of helping others, being financially stable. There's a lot of room to advance in the career. You can work in many different places, in different settings. Like I said before, you can even work out of the country, and there are flexible hours. The disadvantages are it's a highly competitive field, not just the field itself, but also getting into schools. It's strenuous. It can be very emotionally draining depending on what specialty you're working in. You may be required to be on call, and depending on where you live, there are many laws governing the practice of what you can prescribe, what you can do, how many doctors you can work under. It just depends on where you live. The pay and job outlook for nurse practitioners is pretty nice. The Florida salary is an average of $140,000 a year. The national salary is $110,000. The Florida job growth is 25%, and the national is 31%. I was surprised that the Florida job growth was less than the national because of the large number of retirees we have here. But overall, the job growth for this job is pretty nice because of our aging population in our country. I'm interested in becoming a nurse practitioner because I've always been interested in science and human anatomy. I've also felt like I have a passion to help people and make a difference in their lives. Personally, I've on many occasions seen the difference that a practitioner who's compassionate and knowledgeable can make on a clinical situation. And I think it would be a good career if I want to have a family as well.